Welcome to StartUp Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster. It is my pleasure to be here with Ronak Vyas, the CEO and co-founder at MedCoShare. Thanks for joining me today.
Yeah, thanks for having me, Logan.
I have been really excited to have this conversation, partially because of my interest in office co-working. And when I learned that you were doing a type of medical co-working space, you got my attention. So tell me what you're building with MedCoShare.
So you're absolutely right. It's medical co-working spaces. So it's turnkey medical rooms for doctors or anybody in health and wellness providers to utilize. So essentially, they can come in and start seeing patients right away, which is vastly different than the traditional route, which is either you buy the real estate or you sign a long-term lease with the landlord and give a personal guarantee, give a large security deposit. So we've removed all those obstacles in getting started, and you can get started for as little as $500 a month, and as little as a week.
You said $500 a month?
Yep, that's it.
Wow.
Yeah.
Okay, so paint me a picture of the type of provider that would take advantage of this and kind of what it means for them in their professional trajectory.
Yeah, so great question. We have 30 plus providers, and it's everything from a group of ENT surgeons to dermatology groups, as well as several telehealth practices as well. Anybody that wants an address only for telehealth purposes, we would be a great fit for.
What would that look like for a telehealth first provider to be in your space? It's just an interesting sort of flip on the model.
It is, yeah. So it's quick to sign up, but then if the need arises for them to see patients in person, they already have an office that they can utilize and start seeing patients right away. There's a lot of things you can do through Zoom and through telehealth, but a biopsy isn't one of them, right? So I feel like the need, if it ever shifts to seeing patients in person, even once a month or once a quarter, we already have the infrastructure to support it.
One of the things that fascinates me about MedCoShare is this idea of allowing more healthcare providers to become entrepreneurs. You are giving them the infrastructure to put out their shingle, own their own practice. So talk to me about how that has ripple effects, or how you'd like to see that have ripple effects in healthcare.
Yeah, absolutely. So the access to care increases greatly because now private practices can get started really quickly, really easily, and in neighborhoods where patients are. So in a JLL survey done last year, the number one thing that patients look for is location and convenience.
Got it.
Right? So the location is really important. They want to go to doctors that are in their neighborhoods, as well as access to care. So if you want to see a specialist right now, anywhere in the country, sometimes you could be waiting weeks or you could be waiting months, right? 90% of our members are able to see patients with less than a week's notice. Some of them are even taking same-day appointments. So the access to care and the timeliness to care is really important, and that's what's being improved.
Help me understand the connection between the office space piece and the accessibility piece. Why is that unlocking the ability to access a provider?
Right, so the reason why the office component is important is because not only can they get started quickly, but they can get started in multiple locations.
Okay.
So, they can do the hub and spoke model, and we have quite a few members that rotate amongst our locations, so they're serving a greater population pool because of that.
So I'm envisioning that in the old model, a general practice provider or whatever practice, dermatology, you're spending an inordinate amount of your time thinking about real estate, and your costs are sucked up in this idea of having an office, and all of a sudden you're able to be, like you said, a hub and spoke. You're able to expand quickly and more affordably. Is that sort of the idea?
Yeah, absolutely, and I'll give you a real world example.
Okay.
So there's a dermatology group in Philadelphia, and they spent about $1 million for their Center City location, and they wanted to expand to South Jersey.
$1 million.
Right? So you can imagine the thought process and the time it would take to whether they wanted to buy the real estate or they wanted to lease it. Instead, they were able to get started with us in just a few weeks and have a full-time presence in a different market just because they were able to take a few rooms quickly, efficiently, and because they were full-time, they were able to customize the rooms for their needs. So they brought in all their equipment, basically put the open sign up and started seeing patients right away.
Amazing. Something that piqued my interest in hearing about your story earlier was the idea of shared resources. So you've got if you create this building, it's medical co-working, I think about a WeWork or another, office building, and how there's centralized mail or whatever it is. What's your vision for centralized resources for medical practices?
Yeah, absolutely. Good question, Logan. So basically, the real estate only solves one part of the problem. The other piece is staffing or marketing. So those are two additional services that we provide. So we want to be vertically integrated and essentially a one-stop shop for doctors to come in and start seeing patients, and we can support them by, for them utilizing our MAs, or if they have marketing needs, we can handle that. And essentially, they can just see patients while we handle all the back-end stuff.
So you're saying a medical assistant that is floating between different spaces?
You got it.
Interesting.
Yeah.
And you might book them by the hour?
Exactly. Yeah, so you only pay for what you use.
Interesting. So you started in Philly, correct?
That's right. Yep.
Okay, and obviously this is a highly regionalized sort of business because you have to have physical spaces. It's not something that you would scale international overnight. What's your expansion plan like?
Yeah, so right now we have 3 locations. The other one is in New Jersey, and then we have one more in Pennsylvania in King of Prussia. So we want to start growing in the region a little bit more, so expanding north to New York, Connecticut, Massachusetts, but also south down to DC. And then eventually, we'll cover other regions in the country like Florida, Texas, West Coast.
What do you look for in a region that you want to expand into?
We look for 3 different things. One is the population growing, right? Number 2 is what's the population being served by right now? Is there an excess of docs or is there a shortage of doctors? So that's really important. And then what's the infrastructure? So is it close to a hospital? What are the other things surrounding the neighborhood that would make it, enticing for docs to start their own practice there?
Now, you started this business right at the beginning of the COVID pandemic, right?
Yeah.
So that whole year rocked commercial real estate. So talk to me about how that shaped the company that you formed and kind of the challenges and opportunities that it poses.
Yeah, absolutely. So unfortunately, we didn't plan for the pandemic. So we signed the lease in January 2020 and essentially could not open doors for a year until the vaccine came out the following year. So it was a very difficult year. But after the vaccine came, it actually was a 180 for our business because you had a lot of providers that were unhappy or they were burned out. And what the pandemic did is it made the doctors realize that they wanted a different option. And a lot of them enjoyed the flexibility and autonomy that private practice gives them. And this was just a great solution at the right time for them to get started.
Nice. What are you most excited about for the next year of development?
So continuing to expand to other markets, definitely excited about that. In addition to that is just growing out our support services and literally making it a one-stop shop for doctors to get started, to grow, and for them to just start seeing patients. And then, hopefully that escalates to the patients being a little bit more satisfied as well and getting better care.
Awesome. Well, I kind of feel like if you could survive that first year of being hit by COVID, like
tough.
in your first month of business, then you can survive anything. So
Appreciate that.
Love what you're doing. Love how it gives more autonomy to physicians, brings access to care to people who are having to wait months and even maybe a year for an appointment. So love the work that you're doing. Hope you expand rapidly, and we'll be watching you in this space.
All right. Thanks, Logan. This was great.
Right. You take care.
Appreciate it.